Hello, my name is Macy Limberhand. I'm a student nurse and I will be demonstrating a intramuscular injection. So the first thing I'm going to do is determine my 6 rights of medication administration, which are right patient, right medication, right route, right dose, right time, and right documentation. Next, I'm going to perform some hand hygiene. Something. Okay, so for this medication, actually no, I'm going to look at the MAR first, and my MAR says I need to administer 1 gram of Rocephin intramuscularly right now using the Z-Track method. So for this medication, it is a powder, and I need to reconstitute it. So after doing some research, I found that with Rocephin, it is commonly, the diluent is commonly lidocaine, or it can also be used with normal saline, and that is what I have here. So with this medication, I am going to be drawing up 3 milliliters of the diluent. So I'm going to put on my gloves, and I'm going to start by looking at both of these vials, making sure that there's no particles in either one or that either one is damaged or cracked. And they both look good. So I'm going to get my alcohol wipes. And I'm going to pop the top of this one, which is my Rocephin. Maybe. There we go. Okay, so I will clean the tops of both of them. Now I'm going to get my syringe ready, and I have a 3 milligram syringe with a 22 gauge needle, and the needle is 1.5 inches long. Okay, so this needle is not on the syringe, so I am just going to place it on there. Actually, I'm going to use this needle first, which is also a 22 gauge. It just doesn't have the safety lock on it. Or the safety guard. And this needle is also 1.5 inches long. So I am going to drop 3 milliliters of my normal saline. And I will drop the air first. And I'm drawing up 3 milliliters because that is what this calls for. This is a very big needle. Making sure to get all the air bubbles out. There we go. Okay. Now I'm going to mix it in with my Rocephin. Now Now this needle I will take off and put in a sharps container. So now with this, I'm just going to kind of swirl and roll it, making sure not to shake it too hard. And just making sure everything gets dissolved really well. And mixing some more. Okay. Now it is done. It's all ready. So I need to look at the MAR one more time. And I'm actually going, okay, so I will now be getting the actual medication ready, and because of how much I mixed in, I need to draw up 2 milliliters of this medication, because that would be equivalent to 1 gram of Rocephin. So I'm clean that again, apply my new needle, and drawing up 2 milliliters of air. I have a big air bubble in here, so I'm just going to squeeze that out and continue to go for 2 milliliters. And I will recap this now. And we will be using the ventrogluteal area. And to find that, you are going to take your hand, and you want your patient to be lying on their side. So you'll take your hand, and your pointer finger is going to go on the anterior superior iliac spine with your arm lateral to the femur. Your kind of palm of your hand will go on the greater trochanter of the femur, and you're going to spread your fingers out like this. These fingers will be following the iliac crest, and then you would go right in this area to give the injection. Another area you could use is the vastus lateralis, and that is the outside of the upper leg. So you would want your patient to be sitting or laying supine, and you would just take their leg and divide it in half. Like, if this is a person's leg, you would divide it on the half and give the injection on the outer half of their leg. But we will be using the ventrogluteal, so I would have my patient probably side lying because it'd be more comfortable for them. So I would take off my gloves and put new ones on, since I just did all of that, but I don't have any other gloves, so I would be keeping these on, but I would change them. So I will be looking at my MAR again, and it says to get 1 gram of Rosefin to be given intramuscularly to patient rocker or skip rocker. So this is my patient. I would identify him with his wristband. His name is Skip Rocker, date of birth is 02/03/1974, and then all matches. So to get him ready, I am going to get my alcohol swab and just cleanse the area. And I would use my non-dominant hand to find his vastus lateralis. And we would go right in here. Okay, so we are going to be using the Z-track method. So with this, I'm going to take my non-dominant hand and slightly pull the skin to the side. With this hand, I'm going to go dart in, administer all of the medication, and release the skin. I'm going to take push my safety guard up and throw this in a sharps container. Now I could just kind of blot this. Once again, I could apply pressure, but nothing more than that. Okay, now I'm going to go fill out my MAR. And there it says that I administered Rosefin, ventrogluteal, and the date and time that it was given.